This is the external branch of the superior laryngeal nerve. This one. This is coming from the vagus nerve, and this is the superior thyroid artery. Now, this superior laryngeal nerve branch having two classification. One is Cernea classification. In Cernea type 1, this shows that this nerve, if having more than 1 centimeter above the upper pole of the thyroid, is the type 1 Cernea. In type 2A, within the 1 centimeter of the upper pole, this is the thyroid and this is the upper pole. So within 1 centimeter, this is type 2A. In type 2B, if this coming below the level of the upper pole here, then it is type 3 external branch of superior laryngeal nerve. But another important classification is the Friedman classification. In Friedman classification, this is the inferior pharyngeal constrictor muscle. If this nerve is lying above the superficial, this above the inferior constrictor muscle, then it is type 1. In type 2, this lower fiber is passing inside this fascicle of this inferior constrictor muscle, then it is type 2. And Friedman type 3, if this whole nerve is coming below this muscle, this is called subfascial plane. About 20% of cases, this nerve is passing below this inferior constrictor muscle, and this is called type 3 Friedman. And this is the, even with microscope you cannot identify this nerve when this passing from below this inferior constrictor muscle. So these are the two classification. Highest risk, if this passes and we cannot see below this muscle, then this is the highest risk of injury in the Friedman 3 when you can't see. And highest risk is the type 2B in the Cernea when its passes below the 1 centimeter. So these two classification are important. In 20% of cases, you even cannot see with under microscope because it's going intramuscular or below the muscle of this inferior constrictor, that is called subfascial plane. So this classification is called Cernea and Friedman classification. These are the important to identify this nerve, and highest injury in the type 2B, and Cernea and Friedman type 3 having highest risk of injury. So this is given in Scott Brown.